In our center, we actually have the interesting situation that we are manufacturing our own CD19 CAR T cells, but also other CAR T products. So we have been trying to advance this treatment for patients who are not so far eligible for a commercial product. And this may include refractory ALL and DLBCL patients, where, for example, we deployed successfully CD19, CD22 CAR T self-manufactured product for a patient with a highly refractory ALL and a lengthy course that was published in JAMA Oncology last year. And the other area where we are very active together with collaborators from Miltenyi and in Erlangen is to pursue CD19 CAR T therapy for rheumatological diseases, such as, especially in Tübingen, systemic sclerosis. And another project that we are working on, but this is just improving the post-treatment monitoring. In CAR T, we know that the highest treatment-induced morbidity and mortality actually comes from infection-related morbidity and mortality that is related to the immune deficiency and the B-cell deficiency that you induce. And we have a very, very well annotated data set that we are now submitting, or that has actually been accepted last week, where we see that closely following the patients with regard to their IgG levels and their T-cell reconstitution is really a good predictor of how to manage and monitor infectious complications.